Um, all right. I think we are online now. Eu vou só falar algumas poucas palavras em português. Essa mesa toda é em inglês, mas para aqueles que já estão assistindo agora, sejam muito bem-vindos. Eu rapidamente quero dizer que os comentários são muito bem-vindos, as perguntas também. Aqueles que estiverem assistindo e quiserem fazer alguma pergunta após ou durante algum comentário as apresentações, sem problema nenhum. Se conseguir fazer em inglês, melhor, mas mesmo aqueles que tiverem alguma dificuldade com o inglês, não tem problema, podem comentar, podem fazer perguntas em português também, que na medida do possível, da melhor forma que conseguimos aqui, nós vamos traduzir para os nossos palestrantes aqui. Ok, estou falando isso antes de começar em português, que eu imagino que tem as pessoas que estão assistindo, boa parte devem falar português, devem ser brasileiros. So that's it. I was just saying that people who want to comment or want to ask questions, if they don't feel comfortable to make it in English, they can do it in Portuguese, and then I will translate it for you. And that's it. We need people to participate. So Fernando, yeah. Just to start, back one slide, please, Fernanda, the previous one. Yeah. To start, I will present the people who will participate in this discussion about Earth observation data in support of poor communities against COVID-19. And, well, we have three very special speakers today. For me, they are very special. And myself, too. Not so special, but I will try to help them. So the first one is Monika Kuffer. She received her PhD from the University of Twente in Netherlands, and one master degree in Human Geography from Technical University of Munich, and a second master degree in Geographic Information Science at University of London. And she's working as an assistant professor at the Faculty of Geo-Information Science and Earth Observation in ITC, right, inside University of Twente. Her main research focus on urban remote sensing and monitoring the private areas, for example, slums, and analyzing urban form and the dynamics with remote sensing, spatial statistics, metrics. And she's sharing an international network on deprivation area mapping called IDEA Maps. And also she's working on two research projects related to deprivation area mapping called Slum Map. So this is Monika. And the next one is Elsa Rousset. Elsa Rousset, she's a participatory urban planning specialist at the Justice and Empowerment Initiatives, GAI, which aims to empower poor and marginalized individuals to lead the change that they would like to see in their own communities. And Samuel Akinrolabu, that is not here yet, but he's solving some connection problem, and probably he will be with us soon. And he's the profiling and mapping team coordinator at the Nigerian Slum Informal Settlement Federation, which is a mass movement of the urban poor for our dignity and development, with thousands of members from hundreds of informal settlements in Lagos and River States, Nigeria. Both GAI and the Federation, they are affiliates of the Slum Dwellers International in Nigeria. So that being said, these are the guys who will talk to us, and this is why I think they are very, very special. We need to hear what they have to say. And I have a few words to introduce the questions we want to discuss here, and I want to show some slides to help us to understand what I'm trying to say. So when we talk about remote sensing, Earth observing data, and so on, and try to relate it to the COVID-19 pandemic, we can say that the COVID-19 pandemic is also a global phenomenon in terms of the Earth itself. And never have we shuttered so many of the world's most industrialized countries so quickly. So, and that in turn has had an impact on climate emissions, pollution, fresh water, and countless planetary variables. So probably you have been seeing a lot of these pictures on the internet, how the emissions of carbon or the emissions of nitrogen dioxide had lowered down and related to the lockdowns all over the world. So we can say that the public health is showing that it's also an environmental crisis. Public health crisis is also an environmental crisis. You can go to the next, please, Fernando. So most important, we have to remember that we are in a world now that is turned upside down by the global pandemic, and thinking about how to go back to what we call normality. Everybody's talking, wow, what can we do to back to the normal things that we are living before, and etc. But for example, in Brazil, 2.5% of our population went hungry in 2017, which corresponds to about 5.2 million people, or who went starving 2 years ago. Or in the case of coronavirus, for example, a black person has a 62% greater chance of dying from it than a white person in the city of São Paulo, our largest city, and probably everybody heard about it. So first thing, we have to reflect on what normality is, right? We're thinking about how to back to the normality, but when we look to our previous normality, it's real normal, okay? So try to connect it with Earth observation data. Let's talk about the spatial data again. And you can go. This is just to show where Salvador is. This is Salvador, from the people who are not from Brazil, and of course, welcome to Salvador virtually. Thank you for coming. And I will go make a point a part of the city here in the red square, just to show some examples. All right, you can the next, Fernando, please. So what we're looking here is Nordeste de Amaralina in Pituba area. So an important point to be considered in relation to the coronavirus, which has no cure or vaccine until then, is the territorial planning. This is a key point. So we can think, for example, in the concentration of people older than 60 years, like you can see in this map. Right? Are you seeing here? There is some difference in the concentration of elderly people, right? And why I'm talking about elderly people? Because it's something related to how bad can be the disease for them, right? And you can see there's a pattern, a kind of pattern. Some places that are more concentrated are older other places. You can go to the next. Or we can look for comorbidities like diabetes or high blood pressure. And when you look at this information, in this case, it's the accumulated in 10 years of hospitalization of people who suffer from this cause. You can see there's a different pattern, but a kind of inverse pattern. It's not directly related in this case to the elder people in this area, specific area in Salvador. It tends to show a pattern too. It separates this area from the other areas. And in this case, the comorbidities are mapped from the people who used the public healthcare system. So you can see that certain areas that are more related to comorbidities, even they are younger than the other areas of the city, just because they only can have access to the public service and not the private healthcare service, for example. You can go to the next, Fernando. And if you look further, for example, in this slide, you can see the percentage of Black and brown self-declared people in this same area in Brazil. Another pattern tends to appear. So when we look at all the layers together, we can think, oh, okay, what is happening here? There's some different that it's happening here that separates this area from other areas. So this is an important thing. You can go to the next, Fernanda, please. And okay, and that's the point where I wanted to link it to the Earth observation data. Of course, the viruses aren't visible to the naked eye, let alone to a satellite orbiting hundreds of kilometers in space. Still, there are important proxy indicators that satellites can see that are helpful in modeling, monitoring, responding to, and recovering from infectious disease outbreaks. So as you can see here, I'm just showing calculated temperature, average temperature from a Landsat image, and you can see the same pattern. So there are older people in a place, there are people, a lot of people with high blood pressure and diabetes in another place. And when you look to a satellite image, you can see that it's hotter in a specific place than the surround them, right? There are a physical structure pattern appearing here. So such outbreaks like coronavirus, that it's zoonotic one, it's the virus jump from the animals to the people, it tend to be place-based. They emerge from clusters, emerge and cluster in certain place and in certain contexts, and are transmitted along certain pathways. You can go to the next, Fernanda, please. So you are looking now to the vegetation fraction, extract from the same image, Landsat 8 image. Different technique called spectral unmixing, but you can see the pattern repeats. There, it's hotter, less vegetation. People have no access to adequate health services. They have a larger concentration of comorbidities in the same place. So clearly, there is a relation between the Earth observation data in the case of a complex system like a city, or in this case, this is a slum. I can now say to you, this is a huge slum and an old one called Nordeste de Amaralina, that you can see the same patterns. They are registered in the data. This pattern is registered in the satellite images in this case. So these contests are registered by satellite images, drone footage, photogrammetry. It can be read as a summary of the complex urban landscape. And deepening in the structures, understanding, for example, how the distance between houses promote low air circulation and is associated with respiratory disease, we can think about it. Or trash disposal accumulated that can lead to leptospirosis outbreaks because the rodents will live there. So we can see in the image a lot of things that can help us to understand what is happening there. The images can tell a story, not only the images, there are a lot of different kind of Earth observation data. They tell us a story. So that's is what we could call in more epidemic vocabulary, a social and environmental determinants of health. If we put all together and we see that images that are showing a story to us, and you have ancillary data to compare, and this is what we can. If I was an epidemiologist, this is the term that I would use. You can go to the next, Fernanda, please. So now it's much more easy to understand the difference, right? You can see there are different patterns of occupation in the area with high blood pressure and diabetes, high temperatures compared to the surroundings, right? So the way in which these urban systems works, it's kind of interesting. You can go to the next, Fernanda. Right? Yeah, next one, please. I will just point out two areas. Next one, yes. You can see there's different, very clear and different patterns between these two places, even they are close to each other, right? On the left, you have the slum. On the right, you have the Pituba area that is a middle high income neighborhood. And of course, you can see a lot of pools, you can see courts, and you can see a lot of goods, common goods that the people who live there have access, that the people who live in Nordeste Amaralina don't have. And they, of course, they could be, these things can be correlated to help us to understand why they have more high blood pressure, more diabetes, or other comorbidities. The images can help us to tell this story. You can go to the next, Fernanda. So finally, the way in which these urban systems connect with each other different urban systems inside a system, can help us to understand the dynamics of coronavirus transmission, for example, in a varying degree of vulnerability in these communities. Everyone can get infected, but not everyone will have the same chance to survive. This is a key question. For example, here is where the virus came in Salvador. The first cases were registered here. This is the rich area of the city. I'm not going to show you the actual map. It's a red map everywhere. Probably Patricia will show you in the next session. But next one, Fernanda, please. But when you understand how the city is different and how the images and the Earth observation data can show us the vulnerability of the places in certain dimensions, and you try to understand how these different parts of the city connect. This is the origin destination study in Salvador. You can try to model to understand how the disease will spread and how the different places will respond to this according to their vulnerabilities. I think Monika will talk a little bit more about it, probably. But this is an important question. So I'm just talking about this to introduce the problems. And the next one, Fernanda, I want to give time to our speakers so they can talk what they want to talk. But I think there's two questions in this discussion that are important to us. And maybe you can help us to understand. The first one is how can the Earth observation data help to model the pandemic impact, the local resilience, vulnerability, and project a better future, the plan. This is an important thing that I believe that the Earth observation data are useful now and in the post-pandemic and always will be, probably. And the second question is how can this same data help to empower communities and build a better future, not just to project a better future, but how it can help to really, in the reality, build a better future. So this is, for me, the things that I think it's important to put here. And that being said, as I promised, it's very fast. I would like to invite the first speaker, Professor Monika, and I hope you can help us to deepen this discussion. Okay, and that's it. Welcome to Brazil. Welcome to Salvador. And next time, I hope to see you in person, and Elsa too. Okay.
Thanks a lot, Julio, for this great introduction, and thanks for all of you and Patricia and Fernanda for organizing this session, and pleasure to speak on it. I'm from ITC, the Netherlands, but I will give an overview on the use of Earth observation and also the existing data gaps, what we observe presently, which are basically a big issue when thinking about particularly global campaigns, global responses in the context of COVID-19. I think my colleagues from Lagos, Elsa and Samuel, will go much more in a local context. I will stay more on a global context with some examples also from some cities. But looking into what Earth observation data could contribute, and also looking to the question, why don't we contribute so far sufficiently? Because data and systems are not very much in place, particularly when we focus on what I call deprived areas, which are typically the poor urban communities, or in other places you refer to them as slums, informal settlements. And I'm sort of summarizing also a lot of work we do in some research projects, and particularly also in a larger network, which is IdeaMap, which is also inviting people working on issues with poor communities to join to this network, which aims in the end to build like a global data set on deprived areas. So if you could go to the next slide, please. So what you see in principle in the moment is that that actually we would actually need for a global response routine and accurate base map on urban deprived areas. But there's not much in place. The example which is shown is a population data set which was rapidly produced by colleagues from CEDAC in collaboration with NASA on giving population estimate, and also what also Julio was referring to, age distributions of areas, and it's a great first step. It's also a data set produced based on Earth observation data. But what we also observe in this data set, that in particularly the poor communities, the deprived areas, are not well captured necessarily. And this depends from place to place. But I know, and I will also go to some examples where this data set totally fails to capture the population. Could you go to the next slide, please? So what we basically see, what type of data are needed to support COVID-19 responses, and also particularly to support to develop better strategies and campaigns, because what we also hear, like in contact with colleagues like Elsa and Samuel, and also in general, like with the Slum Dweller International Network, that they feel that the standard protocols and the standard approaches, like social distancing, etc., doesn't work in poor communities because of the nature of the environment. And also in a larger team, we have been brainstorming and drafting to have more adapted strategies for poor communities, which is much more adapted to the location. So what we see on really spatial information need to better support COVID-19 responses relate to, in principle, the location, because often the location of areas is not known. The size of areas are not known because they're often not appearing on official maps. We often miss information about densities, population information. Also what Julio was referring to, information about environmental conditions, like the location of waste piles. We are in a moment working, for example, on the development on an EU-based machine learning-based algorithm. Can we extract the location of waste piles automatically, because we know that this might be a danger, and particularly in the case where people are much more staying at home, the waste accumulation in communities is an exponential problem, as was already before, but it's increasing. Physical characteristics of areas, socioeconomic condition, infrastructure relating to isolation units, available open spaces which can be used, etc. So there are all kinds of information needs which are really urgent, and there's a role of Earth observation data to fill them. But particularly for the poor community, it's not very much in place. So if you can go please to the next slide, which shows an example and also why often data are very inaccurate. It's an example of the city of Bangalore. We have been working for a while on it, and it shows the location of slums, deprived areas. And what you see is that all the orange spots are the accounted spaces, the blue spots are the unaccounted spaces. So basically spaces which are not locations of poor communities, which are not appearing on official slum maps. So you see a massive underreporting. If you can click on it, I think there should be some pictures coming up, which in the case of these cities are typically the very temporary settlements, which are not recorded in official data. But there you have hundreds, thousands of people living in these areas, which you have to include in any kind of strategies on COVID-19 responses. In India, you see in the moment this massive migration wave of people flying from cities to the countryside, and it's totally out of control, and there are no strategies in place, and also no good data to support such strategies. If you can move to the next slide. What you also see, and that's an example, a very famous example, and is that typically even the known areas, so that's one of the biggest slum in India, it's the Ravi in Mumbai. And what you see is that you have this yellow boundary, which is the ward of the Ravi, and you see that the census estimates about 450,000 people living in the yellow boundary, but it's locally confirmed that in the red boundary, around 800,000 people live there. If you overlay this with the best global population data, like the World Pop data set, but also the data set I've shown before, like the CEDAC data set of NASA, you get like an estimation of world pop, it's about 45,000. The NASA data set will tell you something like 20,000 people live in this area. So typically, data on urban poor communities in global data sets are totally underrepresented, which has to do with the algorithms, but also has to do with the fact that not sufficient training data are available to train the algorithms used to really predict much better the nature of deprived communities, in this case, the population data of such communities. Another aspect also has to do with what also Julio was referring to, that COVID-19 often combines with other risks, like environmental risk, climate change risk. We know, like, haven't seen in the recent typhoon in India, Bangladesh, that you have to combine COVID-19 strategies with data sets of hazards, like, and also an example of Mumbai, it shows that slums are typically in the more hazardous areas, in the more low-lying area. Also in terms of urban heat, similar story. It shows basically that you typically have in slums a peak of heat. So if you move to the next one, as Julia has already explaining, and that's showing an example and referring also to Elsa and Samuel, the example of Lagos, where you have also a city which has this multiple hazard situation. You have a large part of the urban poor community living into the lagoon. There's issue of waste water. We know that COVID-19 traces are found in wastewater. I think it's not finally confirmed how much the infection risk is, but it's of course a big issue for poor community. And Earth observation can help in the sort of monitoring and also seeing location of standing water, particularly, which are risk for communities. And so in a nutshell, what we see is there are major global data gaps in urban data on deprived community, which has to do with the question of that we don't have enough training data for algorithms, but also that many of the algorithms are not looking very much to transferability, to fitting to the purpose of poor communities, and that often poor communities are not covered well, also with certain intentions in official data sets. And therefore we are looking into like a project which we have on mapping slums in sub-Saharan Africa, looking into developing open source methods for mapping slums with low cost systems, also with low cost data systems, avoiding high cost image data. If you go to the next slide. And aiming for in the first stage, citywide maps for some pilot cities, but in the end, such a system should be upscaled of mapping deprived areas across continent and in a next stage on a global level. If you can go to the next slide. But also looking into the fact that deprivation is not either or, it's not like slum, non-slum. We can also, with artificial intelligence algorithm, predict degrees of poverty. And that's an example of Bangalore, where we used like a deep learning approach to predict the differences between slums. And we are sort of aiming, if you go to the next slide, upscaling it to the whole city, that you can get like a gradual picture of a city showing variations of socioeconomic conditions across a city, and not having this binary map, slum, non-slum, because we see in it also like a sort of a stigmatization of areas. So we want to show like a gradual degree of poverty. If you go to the next slide. And in the whole context, what I started in the beginning of this idea map, which is a network of deprivation mapping experts, we see a very strong need of developing global data sets in support of health issues, but also for other purposes, for example, for training better population data sets, being more sensitive to deprived communities. If you can go to the next slide. And this idea is the combination of different mapping traditions from the field-based community mapping tradition to the artificial intelligence-based approach, and combining the strengths of different mapping approaches to finally produce, in the next slide, you see like a platform which provides for different user groups data. In the moment we are talking about 100 by 100 meter grid, showing the degree of deprivation of urban centers across the globe, and allowing users to interact with threshold settings, and providing like a global consistent data layer which is growing and is improving over time by the interaction also with communities to give a better picture of deprivation and fulfill urgent data needs, which also relate now to what we are here on the COVID-19 responses. You can go to the next slide. So it's basically my final summary is saying that what we see in the moment that there are huge data gaps, and we see a potential of Earth observation, but it has to be linked together with community-based data to really support user and the user needs on the ground. If you're more interested to this initiative of IGMAP, please feel to contact me, and also there's a link of a user needs survey, which we are just launching, really to understand from different user groups the needs of what type of data people are requiring on deprived areas. Thanks a lot. Hope I didn't do too long.
No problem, it's perfect. Thank you, Monika. And now I will invite Elsa. And I don't know if Samuel is coming or not, but you can use his time, no problem, Elsa. And you are welcome too. And we are very happy to have you here to talk with us. And the time is yours. You can start whatever you want.
Thank you so much, and thanks for those two introduction presentation. Again, I'm sorry, my colleague Samuel cannot join us. I mean, I'm still hoping he will join, but he's having some severe issue with his phone right now, so it's not allowing us to join us today. But anyways, we will go on from this. So I'm gonna take a bit of a step back from what we've been discussing so far, and focusing a bit on our methods for collecting data, and then moving on to what we've been doing and what we are hoping to do in light with the COVID-19 situation right now. So yeah, thanks. So just for a bit of a basic introduction, so the Nigerian Slum and Informal Settlement Federation is a grassroots movement. Oh, Samuel is here. That's just perfect timing. Maybe we can hear from him then, so he can do this, and I will join us later to talk about what we've been doing in light of COVID-19 situation. So I'm just going to mute myself and let Samuel keep going. I haven't said anything, Samuel, so you can just go.
Hey, thank you. Good afternoon. Early this morning, my phone developed a serious fault, and I've just been running up and down to fix it up. So, but the most important thing is that I'm here, and I'm privileged to be here. So in what we do, and in Lagos concerning this COVID-19, and as a movement, I will first of all introduce the movement, which is the Nigerian Slum and Informal Settlement Federation. Is a movement of the people, the urban poor, for their development, and we are actually come together because we have a common challenges and common aspiration, and how we can deal with the aspiration and the challenges. That's why we have to organize ourselves using the SDI tools, the SDI methodology, and then the movement is affiliated to Slum Dweller International, which cuts across 33 countries in the world, and then we are supported by Justice and Empowerment Initiative, JEI. Part of what we do as a movement that is affiliated to SDI is the profiling, where we go to community to gather community information. that can be very, very useful to the community. And when we gather the information, we are talking about gathering what are the challenges, what are the community priorities, community challenges, the demographic, migration in the community. So uh, uh, these are some of the things that we do in profiling, and it starts its own stages, whereby we go to communities to firstly we do boundary mapping, and in that boundary mapping we try to get the coordinate of communities where, and we get the coordinates, we actually do the tally process, and in the tally process we actually structure, mark the structure of each residence and household in the community. At the end of the day, we can be able to estimate the number of people that reside in that community and the number of structures in that community. So again, we have a focus group discussion, and in that focus group discussion is where we come with our questionnaires and they ask about the history of the community, how the community came to be, who actually owns the land, and what are the community priorities, what are the community issues, the community have the organized leadership. So these are some of the questions that we ask. So, and we actually do enumeration, which is getting details information of individual household. So in all of these things that I've mentioned, the community is at the center, and it's because the community knows their boundary, the communities know themselves, and all of this data has to go back to the community, because it is the community that will actually come back at the end of the day to actually plan what are we going to use our data for. The data is not for the movement and it's not for the NGO, which is Justice and Empowerment Initiative, but the community owns their data. And at the end of the day, we organize a community meeting, and whereby we actually give the data back to the community. But before we do that, we make sure that the community put a checklist and actually see, does this data actually represent us, and they put checklist on all of the data that we've gathered, and at the end of the day community will come together and say, oh, this actually represents the real community where we are, and we can now take, okay, having identified these challenges, how do we make sure we actually move the data a bit from paperwork and actually see it in practical times. And these are some of the things that we actually do in the community. So the community owns their data, the community. So before we start all of these things, we have to organize a community training where we have to train volunteers from the community. So because it's them that is leading in all of this process. So we train the community people, and then when we train them, we kind of support them from the back. Because one, why are we doing this? Because one, to make sure we get trust from the people, and then to make sure that this thing is actually led by the community themselves, so that we can at the end of the day get accurate data, accurate information that will be representing the community. And at the end of the day, the community is actually involved in all of the stages where we gather community information, community data, which actually represents the community. On this note, I will have to stop and let Elsa continue from where I actually stopped from here. So there are much example of community that we actually give them their data, like Musafejo community in Lagos, Musafejo Idiaraba communities in Lagos. So these are some of the communities whereby we've actually gave them return their data to them, and there is a lot of community representation to put a checklist on what we do to actually, before they accept the data as a true representation of the community. Thank you, everyone.
Thanks, Samuel. I think I will directly take the lead since. So I guess we can move to the next slide, which is some picture showing communities members actually like speaking about the data and having the discussion where they check that everything is actually showing and reflecting their own realities. So you can see some graphs on the banner behind. And another point on just our methodology to gather data, like it's been mentioned by Monika before, but the fact that we don't have data on a global scale, it's true, but it's also true on just like a city scale or a national scale. Most of the time when you look at map, in Lagos, for example, you can see empty spots. And I can let you know, I've been living in Lagos for a year and a half, and Samuel all his life can let you know, there is no empty spot in Lagos. Lagos and empty doesn't go together. So if you see something empty in a map showing Lagos, it's actually very probable that it's a slum communities that just are not part of the map. And that's why we have as one of our motto is like putting our communities on the map, which is something very important because it's most of the time not included. I'm now going to talk more about like this aspect on COVID-19. Can we just go back to the previous slide 1 second? So this is what we've been doing since the beginning of the crisis in Nigeria. We've been changing from on-ground actions to actually phone call and doing survey on the phone because we cannot move. Lagos just eased the lockdown, but we had an entire month of lockdown with no movement allowed. And of course, as a movement, we didn't want to take any chance in spreading the virus in the communities. So we moved to this phone call survey that encompasses 39 questions, doing a bit of education and prevention, and as well as monitoring the health situation, as well as the impact for people, because we know that, as has been mentioned by Julio, the impact on people living in informal settlements and slum are very, very more important than if you're living in other places of the city. So we've been able to run this questionnaire in 154 communities, and we are running it weekly to get the evolution of the situation. So if we move to the next slide, this has allowed us to identify 3 main priorities in light of this crisis, which is prevention, testing, and isolation. So for all of these priorities, we are now trying to develop new tools and actually relying also on Earth observation data to be able to move forward on those 3 priorities. So the first one is prevention. So how do you try to prevent the spread of COVID-19 in slums and informal settlements, and taking into account what is happening on ground, which is like a very high density, the impossibility of putting really in place like isolation or self-quarantine, because most of the time like one family shares one room, so how could you quarantine or isolate from this on ground? So speaking with our volunteers and communities, we are trying to develop processes, trying to mapping hotspots in community, trying to know where are the places that people maybe should try to avoid to limit the risks and the chance for them to get the virus. So this is example like places where people gather. So like if there's only one big entrance to the communities, like how do you try to manage this kind of space? Also, if there is, it's very likely that you have some pattern inside the community. And so what are the most used streets and what are the backup streets you could actually use to try not to go on this like most traveled road, if I can say. Another one is actually mapping the hand washing station. So we are yes, you can move. Sorry, you can move to the next slide. We are helping the communities to build themselves some washing station using the tippy tap method, which is very basic and relying actually on tools and material that they can easily found in the community, so they don't need to move to build it. And then the idea would be to come up with maps of where those those hand washing stations are, and where they should be as well, like where we see needs for building those, especially at like bus stops, so everyone could wash their hand before they enter buses, or this kind of idea. Then moving next, on testing. Actually, right now, like I said, there's been a lockdown in Lagos for about a month, and we are seeing the easing of the lockdown. But the easing of the lockdown does not mean actually that the situation is under control, or that the virus is no longer spreading. Actually, like if you look at numbers, we are still rising every day with more and more cases. So how do you make sure that people living in slums and communities are able to get access to tests? So we are trying to get process in doing the door-to-door screening, which, if we move to next slides, is adapting what we already do, which is like house numbering and tally, to go to each household and then get a basic A4 paper written, and screening everyone, like did they had any COVID-19 symptoms in the last 7 days, and helping those people, if they have been experiencing the symptoms, to get in contact with the adequate government institution and being able to be tested. Because we see two gaps. Is like, one, that member doesn't know how to get tested and where to get tested, and that also like the government agency don't know where are the people and who is suffering from those symptoms. Another idea is mapping health center status, because some have been closed since the beginning of the crisis. So it's also knowing, where can you have access to healthcare. The next slide about isolation. Is, like I said, isolation is very complicated if you live in those communities because of the way housing is. And actually, following up an example of what have been designed by the SDI Alliance in Kenya would be to map out some places, especially schools and church, that could be used to set up a community isolation center. Because there's also a big mistrust from members of the community to actually go to the isolation center set up by the government, and then a more global question is like, are those isolation centers really been designed to reach out to those communities, because they are all in wealthy and high-end neighborhoods. So it will literally means for those people to cross from one side to the city to the other. So it's not really targeting the community of the slums and informal settlement. So that would be yeah. And if you want to learn more about our work, we have all our contact here, and we also been doing Corona Diaries, which is some innovative media, clearly giving the voice to those in those communities and how they're facing coronavirus. So thanks. I think we move on now to questions.
That's perfect. And thank you for Samuel to join us. Perfect time. And I just want to thank you everyone that participated in this session, and really want to thank you. It's a wonderful time for me. And okay, we have some questions here. I can make a comment, but probably you guys are seeing this in the private chat here. And some of the first one I can answer, but there's some questions from Monika, and that's it. Let's see what we can do here. The first thing, it's wonderful to me to see how the things connect, the different scales, what Monika presented, and now on the very fine scale, what you are doing in the house itself, in the case of Nigeria, right? Some kind of cadastral mapping. It's a wonderful. It's in both cases, one thing that appears to be recurrent is the data gaps, and this is one of the main things that brings us together. How can data, Earth observation data, or the kind of data can help us? And the data gaps don't let us to work in an appropriate way, right? Like in Salvador, we have a lot of data gaps too. We don't know exactly where the COVID cases are. We don't know in the right time. There's a time gap to plan, to do something. In this case, a specific case of a pandemic, it's the time, it's a key. thing. You have to do the things fast and in the right moment. I cannot playing with data from 2 weeks ago, not working. Okay, so I think this is an important point that you can, all of you can talk about. And someone asked about the scale mapping, and I think it's about my scale mapping, but if it's by number of or per million people. And I think it's you are talking about the diabetes and hypertension in this case. That one is just a cumulative number sum, but we are working on some indexes, and then we're going to normalize it and divide by population, different ages, and using in a more adequate way. That one is just one example, right, by census tracts. But that data is not normalized or none of that thing, but we are aware of this. We are working this. And okay, for Monika, in Latin America, Africa, and Asia, there's a large proportion of people living in slums with different degrees, like you said. And the question is, can we always expect the same health outcomes in relation to them in the case of the number affected by COVID-19? And what do you think is the most important things that you can extract for this data to help us to understand the outcomes?
It's a very good question, and it's a question where I don't have a very straightforward answer on, because for sure, let's say the conditions are not the same. Like, just if you think about a slum, like a slum, what you would label a slum in Brazil, like in Salvador, people will have a very different condition in terms of access to water, sanitation, as compared to like a slum or deprived community like in Lagos, living in the lagoon, which has a very different condition in terms of the housing condition, access to basic infrastructure. They're both deprived, and both would require very specific strategies in dealing with COVID-19. And you need really ground data. Let's say Earth observation data can sort of provide base information. It's also, let's say, if you go to a very sophisticated model like I showed for the city of Bangalore, it's fed with very rich ground and qualitative data from the ground, and you can train artificial algorithm, intelligent algorithm to map socioeconomic variations on a city. But the key is really data from communities. Without this from the desk, you will not understand anything in images. And then the question is, of course, and you will then need again going back to the communities and see how these different socioeconomic and physical conditions relate with different health outcomes. And for sure, you will have different health issues depending to the different type of environment people living in, whether they have access to safe water, whether they have what type of housing they are having. So all kinds of conditions will impact contact with any kind of diseases, environmental conditions, multiple risks which are overlapping. So I think it's a very complex subject, and we understand so far too little, also because of the huge data gaps. I know it from colleagues working really in the health research, saying they cannot quantify health outcomes because they're missing base data. They cannot say what is the difference of life expectancy as a person who is living in a slum in one city as compared to a person not living in a slum in another city. You see, like between cities, sometimes they come to 10 years, in other cities you come to 20 years of difference in life expectancy, which is huge. And of course, you will have variation even within one city, depending in which area you will live.
Thank you. For Elsa and Samuel, what kind of data the communities you work do not want to show in the map? I don't know if you get the question. Do you face this kind of restriction? What do you want to show on the map? You are filling the map gaps. So
maybe
sometimes, I will. Okay, you can go on, Elsa.
I think it's not really like they don't want to show some data on the map. In case of communities in Lagos, in Nigeria, and in many other countries, actually, it's all go back to like, what do you want to do with the map, and to whom do you want to share it with, and what do you want to achieve with this map? Because there is actually some information that could be used against the community. One example in top of my head would be like showing the date of establishment of a community. That could be very tricky because if it's quite a recent one, then it can be used as a reason to actually like going for an eviction, and like for the government to undo an eviction, saying, oh yeah, well, you just happen here, you are like migrants, you're not really Lagosians. So this could be like a very tricky data, for example, to share at a larger scale. And then when we do enumeration to personal data like identification document or this kind of thing will not, of course, will not be released. But maybe Samuel, you want to add something on this question?
Yes. First of all, when we go to community, we try to create a trust between us and the community residents, and the trust will go a long way to put them on the safe side. I know there are some communities that they don't like to show them on the map, so that the government might come and know they exist in that particular area, and government might come overnight and said, oh, they want to demolish them. So these are the people's fear. Let me give you an instance of the community I live in. There was a time we have this drainage that passed through my community, and we we the drainage is blocked, and we want the drainage to be cleared. So we want to write a letter to the Lagos State government to make sure that the drainage is evacuated. But because people have encroached on the stepped back, they don't feel comfortable writing letter to the government, because they know when the government comes, they need to demolish the number of stepped back that they've encroached on. So these are the type of fear that community might have sometimes. And in the times of doing household enumeration, there are some times that there are some details and personal information that people would not like to release to people. Like, for example, we've been having much difficulties to get how much do you earn. For example, some people don't actually know how much they earn, and so people that actually know, most times they don't feel comfortable disclosing how much they earn. One, based on the fact that, oh, somebody that is living in my community and is the one doing this survey, administer this surveys to me, you will know how much I earn. So my take home becomes public, and so this is kind of situation that we face. But rather, we have a way of maneuver all of these situations, and we make the people to feel trusted and make sure that, oh, this thing is, we have their consent, is not going to be published online or quote their names, but tell them that the details of their information that they don't want to reveal will not be exposed. So this is kind of strategy we use to make sure people are comfortable answering this question. Thank you.
Thank you, Samuel. Well, we have less than 1 minute and a lot of questions. I think we have no time to answer all of them, but we're gonna share your website and Instagram, etc. And I hope we can talk together again soon. well, we're going to try to organize something different, because I can see there are a lot of aspects that are not even close to discuss right now, and we have to do it, especially for us in Brazil. We are facing the pandemic. The pandemic's hit harder here too, and a person is dying every minute in Brazil, and our president is not helping us to provide to prevent it. So we need this conversation. We have to help each other in this time with data, with information, and with discussion. And that's it. Thank you for participating with me with this. Thank you for all the people watching us, and hope you like it. I enjoy it very much. Bye-bye.
Thanks, everyone.
Bye-bye.
Thanks a lot. Bye. And thanks for sharing.
Thank you.
Bye.